So welcome guys, welcome to the channel, and this is the last leap of bacteriology. It's going to be a tough session and it's going to be a major session, but I will just try to mention the points with the various bacteria under which we are going to discuss the important topics. The first one being the Haemophila, Bordetella, Brucella, Chlamydia and Mycobacterium tuberculosis, and non-Mycobacterium tuberculosis and mycoleptral spirochetes, Triponium pallidum, Borrelia, Leptospira, and then Rickettsia and Coxiella species. Okay, so these are the topics under which we are going to have today's session. It's going to be a long session, it's going to be a tiring session, but we will just try to make it as simpler as it is. And as I've been saying while now, always go with your notes first. Go with your notes, go with your revision, go with your plan. But when you aren't sure that when you are done preparing, or when you don't know where to stop, or maybe the revision, where to stop your revision schedule, just come to this channel and click on the topics and you can just hear it out. So without wasting of further time, and we will just get started now. First is the Haemophila. So Haemophila, it's a non-motile, non-sporing, gram-negative. So Haemophila, Pfeiffer's bacillus, okay, Phila, Haemophilus influenza, Aegypticus and Ducrey. So everything comes with that F sound. So it is a Pfeiffer's bacilli, and it is a non-motile, non-sporing and a gram-negative bacilli, and it's an Haemophilus aegypticus is also called as Aegypticus, Koch, weak, eek. Okay, so Koch, weak, Aegypticus. Okay, and then Haemophilus Ducrey. Then coming to the Haemophilus influenza, also called as the Pfeiffer's bacilli. So 5 and 10. So 5 and 2 are the two virulence factors present here, and outer membrane protein. And virulence factor is the capsular polysaccharide. 6 types. 6 types is the A to F. Haemophilus influenza B type is the most virulent, and it is used for vaccination. Totally 6. B used for vaccination. P first factor 5 and factor 10 used NAD and human present. And Haemophilus influenza polyribosyl ribitol phosphate, it induces IgG and IgM and IgA. It is used for immunization. Okay. Haemophilus, the phosphoribosyl ribitol phosphate, PRP, it is used here. It induces IgG, IgM, GAM. It induces IgG, IgA and IgM, and that is used for immunization. Then coming to the pathogenicity. So pathogenicity, it is invasive and non-invasive. So invasive, it spread through the blood, meningitis, endocarditis and pneumonia it causes. And non-invasive, it is usually in adult, it is an unencapsulated form, whereas invasive is in always remember, invasive mostly will be capsulated form only, and it occurs in children. And in adults, unencapsulated, so spread locally from the throat. Okay, so coming to the clinical features, meningitis, and 2 months to 3 years, the children do not have anti-PRB antibody, that phosphoribosyl ribitol phosphate antibody. So older children develop immunity to subclinical infection. So second is the croup, and third is the pneumonia, and fourth is the suppurative lesions. Okay, then specimen. So specimen is the CSF, blood sputum. Precautions. No refrigeration must be done, because I will just explain. Just remember that no refrigeration for this technique. Refrigeration is kind of contraindicated for Haemophilus influenzae, and it is a small microscopic examination. We saw small gram-negative and coccobacillary forms can be seen, and culture characteristics. I already said no Pfeiffer's bacillus, factor 5, factor 10. So factor 5 is made up of NAD and factor 10 is made up of hemin. So why am I saying this? Because in culture characteristics, 10 factor hemin factor is the heat stable factor needed for, so more number is there. So 10 is a bigger number, right? So it is a heat stable factor, so it is needed for synthesis of cytochrome and enzymes like catalase and peroxidase. Okay, so it carries bigger functions, so it is heat stable only, obviously. Whereas a factor 5 NAD or NADP is an heat labile smaller form, it's NAD, but then what is the use? It is used for metabolism. Then coming to the various forms of Haemophilus. Okay, so we are just having a list of Haemophilus various types, and factor 10, factor 5, CO2 and hemolysis. Depending upon these characteristics, we are going to classify these things. Okay, then Haemophilus influenza is the predominant. Okay, so it contains both the factor both the factor 10 and both the factor 5, but CO2 and so Haemophilus influenza. So Haemophilus influenza and Haemophilus agiticus, it has both the factor 10 and factor 5, and CO2 and hemolysis no response. And Haemophilus ducrei, do means D is a smaller number, so it doesn't contain 5. Okay, D for 10 means 10. Okay, and then para means 5 is present. Okay, so para influenza 5 is present, para hemolyticus 5 is present, and para Prophilus 5 is present. Okay, so I will just explain about the CO2 characteristic and hemolysis characteristic. Just remember that hemolyticus only and parahemolyticus only hemolysis will occur. Other subtypes no hemolysis occurs. Okay, then aprophilus, paraprophilus, CO2. Okay, aprophilus and saprophilus, from the name we can infer that it is a CO2, it grows on the CO2, whereas the hemolyticus both forms for the hemolysis. And then aprophilus, paraprophilus factor 5 is present, aprophilus factor 10 is present, para-influenza factor 5 is present, ducrei is present, agiticus hemoinfluenza more the same only. Okay, then how to remember that aegypticus and influenza? Just remember the mnemonic HAI, HAI. So Haemophilus aegypticus, Haemophilus influenza, it contains both. Then culture, coming to the culture. So culture is the we already said that RBC lysis, so chocolate agar factor 5 is released from the RBCs. So chocolate agar is seen, and then in blood agar staph aureus streak, and nutrient agar with the disc factor 10 and factor V. In nutrient agar that is grown, Fildes agar is used for isolation. So nothing specific here, just remember that chocolate agar is used, and that factor 5 is released from the RBCs, and that is responsible for the growth, and nutrient agar has both factor 10 and factor 5, that is responsible for the growth. And blood agar we are just growing it alongside with the staph aureus streak, because satellitism is exhibited, and factor 5 and factor 10 is released by the hemolytic property of the staph, that because by using that it grows. Then treatment is by the ceftriaxone, prevention is by the HIB, because B is the most virulent form out of the 6 A to F forms, and phosphoribosal ribitol phosphate vaccine. Then coming to the Haemophilus aegypticus, factor 5 and factor 10 through Koch-Weeks bacillus. Okay, so Koch-Weeks bacillus causes is the Brazilian purpuric fever, conjunctivitis leading to septicemia, and pink eye. Okay, Brazilian purpuric fever, conjunctivitis leading to septicemia, and pink eye. So aegypticus, I have already said that aegypticus EE, so Koch-Week. Okay, then fission stream appearance is for Vibrio. Okay, whereas school of fish is for Haemophilus ducrei. There is a difference here. Fission stream for Vibrio, school of fish or railroad track, that is for Haemophilus ducrei. Okay, school of fish, school. Okay, then chancroid or soft core, sexually transmitted infection, is a non-indurated margins of the ulcer. Treatment is by erythromycin and cotrimoxazole. And school of fish and railroad track appearance. Then Haemophilus produces a chancroid. Okay, chancre only syphilis, chancroid is ducrei, soft sore, STI, non-indurated margins of the ulcer, it is a painful ulcer, whereas syphilis is a painless ulcer. Then coming to the Hackett group of organisms, Haemophilus aggregatobacter, cardiobacterium, Echinella produces Echinella, it produces, name itself says some jerky. So Echinella, some jerky motility is seen, and twitching is seen, and Kingella. Then what it causes, main cardio, so endocarditis, respiratory infection, and UTI, most predominantly endocarditis is seen. Then coming to the Bordetella pertussis, so whooping cough, also the 100-day cough, non-motile, non-sporing, and capsulated capsule is present. Then virulence, coming to the virulence of the volatile, is agglutinogens is used for attachments, filament, the hemagglutinin for attachment, and pertactin outer membrane protein, then antibody for filamentous hemagglutinin or protective. Filamentous hemagglutinin is used for acellular pertussis vaccine. Okay, for Haemophilus influenza, HIV is used. For varicella, FHA is used. Acellular pertussis vaccine with pertactin. Okay, with pertactin. Pertussis toxin and pertactin is being used here. Okay, FHA is very important here. Then coming to the pertussis toxins, under the pertussis toxin, it is expressed on the surface. It exhibits lipocytosis producing factors or lymphocytosis it exhibits, and HSF means histamine sensitizing factor, and IAP means islet activating factor. Only in animals it increases insulin. Okay, only in animals it increases insulin. HSF means histamine sensitizing factors, and lymphocytosis producing factor. Lymphocytosis producing factor for lymphocytosis, histamine sensitizing factor, and islet activating protein. Only in animals it increases insulin, and adenylate cyclase increases CAMP, heat level toxin, and tracheal cytotoxin, and lipopolysaccharides LPS. Everything is acts as toxin here. So main what we should remember is the pertussis toxin we have to remember, and this lymphocytosis producing factor, and histamine sensitizing factor, and islet activating protein. These should be said, and AC adenylate cyclase increases CAMP, heat level toxin, and tracheal cytotoxin, and LPS lipopolysaccharides. Everything has to be said. And coming to the clinical features, incubation period is 1 to 2 weeks, and disease is whooping cough and pertussis. Phases is the catarrhal phase, paroxysmal phase, and convalescent phase. Catarrhal phase is the low grade fever, dry cough, maximum infectivity phase, and paroxysmal bouts of cough, inrush of air into the lungs, oof. So that is the reason for the oofing cough. It's because of the inrush, not the outrush or maybe any expiration. It's inrush. Okay, bouts of cough, and low grade cough only produced, dry cough, maximum infectivity. Okay, usually we tend to think that in the catarrhal phase it's going to be low infectivity, but contradictorily here maximum infectivity and low grade fever is seen. Okay, so in a question when we come across like low grade fever, dry cough means we usually the infectivity is given as minimum infectivity, but that reality is maximum infectivity. That is an important key point there. And the paroxysmal stage, it is the bout of cough, inrush of air, whooping is produced, and then convalescent only there is a decrease in severity. Okay, paroxysmal is not the severe, catarrhal is the severe here. Okay, C comes first, so C is the maximum. And then complication, pressure affects subconjunctival hemorrhage because of the repeated coughing, respiratory complication because of the repeated coughing, lung collapse, atelectasis, neurological complication, cerebral hemorrhage, convulsions, coma, and infections is limited to the respiratory tract. Basically do not invade blood. Okay, that is a point here. Basically do not invade, it is invaded to the respiratory region. And the diagnosis, so diagnosis obviously pernasal, postnasal swab or peroral swab. Pernasal along the floor of the nose it's taken. Postnasal is as said is oral, peroral swab. Cough plate method 10 to 15. Ideal is the 10 to 15 centimeters away from the mouth. Swabs are transmitted in casamino acid solutions throughout media. Okay, then coming to the specimen culture and appearance. Okay, specimen culture and appearance diagnosis. So the specimen culture and appearance. Okay, specimen I already said, and culture. So culture is by the bordered gengu. So bordered gengu and Reagan charcoal blood. So charcoal blood agar is a previous year question, very important too. So bordered means you have to remember just 3 cultures: bordered gengu, charcoal. Just remember charcoal, bordered gengu, that will come in handy. Regan loei, if possible remember Regan loei. Okay, coming to appearances. Appearance is the bisected pearls. So bordered gengu, bordered bisected pearls. Okay, so bisected pearls, it will be like pearls, mercury pearls spread over the culture, like that only it is appear. Aluminium paint appearance confluent with and then a dome shaped glistening, that glistening, clean glistening will be there. Okay, so when it appears like a mercury droplets, just go with bordered Gengu medium and bordered tella. Okay, so bisected pearls, mercury drops and aluminum paint, that is important. Then colonies on the bordered Gengu, growth is slow, 48 to 72 hours. Colonies are small, dome shaped, smooth, opaque, viscid, greyish white, refractory and glistening, resembles bisected pearls or mercury drops, surrounded by hazy zone of hemolysis. That is important. Hazy zone of hemolysis is also present. Confluent growth presents as aluminum paint appearance. Then coming to the treatment, drug of choice is erythromycin and azithromycin. Prevention is by the whole cell killed vaccine. Complication by the post vaccinal encephalopathy. Okay, complication for the whole, because we are using whole cell vaccine, right? So complication will be post vaccinal encephalopathy and hypotonic hyporesponsive episode. And acellular vaccine, pertussis toxin, this filamentous hemagglutination, and PERT and AGG. AGG means adenyl cyclase, that thing. Okay, so that those are the toxins can be used for preparation of acellular vaccines, whereas whole cell vaccine can be used, but it gives more complication like post vaccinal encephalopathy, hypotonic hyperresponsive episode, like that it but acellular vaccines are preferred, like PT, like pertussis toxin, filamentous hemagglutination and adenyl toxins and pertussis. So these are preferred here. And then coming to the third bacteria, that is the Brucella. So Brucella, it is a zoonotic Brucella, it is a zoonotic disease, and Norman system. The system of classification is the Norman system, DNA hybridization. So Norman. Okay, just remember that. Nothing. And coming to the under no DNA hybridization, B group, we study melitensis, sheep, goat, abortus cattle, and Sioux is pig, can is dogs, O is sheep, and Newton rodent. So any other thing you can just say abortus cattle guesses, Sioux is pigs guessable, Canis is dogs guessable, O is sheep guessable, Newton also rodent guessable, militants is sheep and goat, that is not guessable, and that is the question. It's most pathogenic. Okay, just remember MASCON, mask on, because of the COVID time, just remember mask on. Militants is abortus, Sioux is Canis, O is nematode. Then coming to the antigens, so antigens is the Brucella abortus, Brucella militensis. So abortus A, militensis M. Antigenic cross reaction is present between Brucella and, can you remember, Brucella is cross reacts with BES. Okay, save, just remember save, SEV, save. So S for Salmonella, E for E. coli and Vibrio, and B save, mask on, B save. Okay, then a virulence factor is the lipopolysaccharides, and Brucella binding factor R and Brucella binding factor S. It is used for binding only. Then zoonotic disease, most common is by the direct contact or by consumption of the raw milk. Direct contact is the most common, and it infects the cells and it enters into the reticuloendothelial system and engulfed with the macrophages, dendritic cells, placenta, and incubation period is 10 to 30 days. Okay, 10 to 30 days. Night sweat. Then zoonotic disease. Okay, bordetellus and zoonotic disease caused by the direct contact and with the consumption of the raw milk. It affects the reticuloendothelial cells, the macrophage, dendritic cells. So triad is seen in the bordetella. So what is the triad? It is the night sweats, arthritis. Okay, night sweats and arthritis and hepatosplenomegaly, because the reticuloendothelial system resides in the spleen and liver predominantly. So that is the thing here. Night sweats, arthritis and hepatosplenomegaly. Incubation period is 10 to 30 days. And Brucella can have predilection for the placenta. It contains erythritol. Okay, that is important here. Okay, so it is erythritol, so that is important. And it is stimulating effect, that erythritol it activates or maybe stimulates the Brucella. Okay, then coming to the types, latent infection, acute, subacute and chronic. Latent infection is no clinical evidence or serology. Acute or subacute is the Brucella militensis, fever, myalgia, arthralgia, nocturnal sweats, platelet counts, bleeding, decrease in platelet count, bleeding, and chronic is the low grade fever. Okay. Latent infection is the no clinical evidence. Serology, acute, subacute is Brucella melitensis, fever, myalgia, arthralgia, nocturnal sweats, and decreased platelet count for bleeding, chronic for low grade, and recovery. Immunity is cell mediated, Th1 cells, macrophage mediated, and Th1 only. Immunity is CMI, not humoral, CMI. Okay, just remember that Brucella CMI only mediated, because most is intracellular organisms. Right? When it comes extracellular, only the humoral will come now. So it is only intracellular organisms, Th1 and macrophages, TNF alpha and interleukin 1 and 2 is involved. So just remember these names, and that is helps in the elimination. And note, in India, Brucella melitensis. So Indian military is powerful. So melitensis, that is the most common. And diagnosis by the Castaneda medium. So Castaneda medium is it's a biphasic medium. It contains both liquid and solid. It is an automated medium. Antibody detection by standard agglutination test. Castanella medium. So Castanella medium, I think it's made up of a triticase soy broth. It contains both solid and liquid medium, and it grows by Brucella melitensis and Brucella suis, and it can be grown more easily. And standard agglutination test, dilutions, serial dilutions of the serum plus a standardized killed antigen Brucellus abortus is being used. So in a Castaneda medium, we have triticase soy broth. Okay, in triticase soy broth, but here in standard agglutination test, we have serial dilutions of the serum plus a standard killed antigen. It's a killed antigen for Brucellus abortus. Okay, and false positive due to cross reactions is being with the present. And I already said that the cross reaction is seen between, can I remember, B save, mask on B save. Okay, so B Brucella cross reacts with SEV, E. coli. Wait. Brucella cross reacts with excuse me. So Brucella cross reacts with Vibrio cholerae, E. coli, and Salmonella. Okay. Then here serial standard agglutination can have more false positive test. Standardized killed antigen of B Bacillus abortus is used, and serial dilutions of serum is used. False positive due to cross reaction, 37 degrees Celsius, and 24 hours. Titer is more than 1:160. Okay, IgM plus IgG significant titer. More than 160 is the significant titer, and treat with 2 mercaptoethanol because IgM is destroyed. Okay, on treatment with 2 mercaptoethanol, IgM is destroyed, and titer is more than 1:160. That is a significant. Okay, then what are the other tests? We are using milk ring test, Bengal card, via agglutination. Everything is done in animals. Okay. Then a milk ring test, a few words about it, to detect the Brucella antibody in milk. Milk with stained Brucella antigen is given. If antibody present, agglutinin marked by a blue ring. And treatment doxycycline for 45 days, long coverage doxycycline plus streptomycin IM daily for 14 days. Very long coverage is given. Okay, coming to the chlamydia. So chlamydia is an intracellular gram-negative cocci, no peptidoglycan cell wall. ATP is used from the coast. Because of this reason, earlier it was classified in the parasite, but now it is given as a chlamydia. So classification: chlamydia and chlamydophila. Okay, chlamydophila pneumonia exclusively for human. Okay, seen in human. Chlamydia trachomatis inclusion bodies. Okay, I will explain the bodies. Chlamydia trachomatis is the HP bodies. Molluscum contagiosum also HP bodies. Don't confuse with that too. Inclusion bodies are seen in glycogen matrix. Okay, chlamydia pneumonia, chlamydia psittaci, inclusion bodies without glycogen matrix. So that is the reason why I have just put this point. Chlamydia with, it's ancient, so chlamydophila without glycogen matrix. Okay, but chlamydophila pneumonia, it's exclusively in humans. Two forms, and elementary body and reticulate body. Elementary body, RNA is equal to DNA, metabolically inactive and small, whereas the reticulate body is an intracellular. RNA will be greater than, intracellular means RNA will be greater than DNA, it's active and large. That is the reticulate body. So reticulate body is a big thing. So network, no, so network has to be big. Elementary is already small, so it is small, inactive, DNA and RNA equal, and it is extracellular only. When it is a big and powerful one only, it is goes into the just remember the word parliament. So in parliament, the powerful people only stay inside, but the powerless people stay outside. So elementary body stay outside, whereas the reticulate body with high network power goes inside only. So it is an intracellular, this is extracellular. Let's relate with parliament and read. Okay. Then coming to the growth cycle, so the entry is usually made by the elementary body, the person outside the parliament. So it becomes dormant and it becomes enclosed by a vacuole, and then metabolism undergoes it then develops into, after so many tough competitions only, the normal citizen can become a successful politician and enter into the parliament. So it develops into the reticulate body. It usually takes 8 hours, and then maturation of the 8 hours reticulate body happens, and then the release of the, and then conversion of the, after the election, when the party fails, reticulate body is converted into elementary body is released. And then antigenic properties. So genus specific antigen is the lipopolysaccharides, and species specific protein antigen is used for classification. Okay, and serotype specific antigen is for intraspecies classification. Okay, chlamydia pneumonia, chlamydia psittacosis, chlamydia trachomatis. That then how are we studying that different species is for, by the studying a serotype, species specific classification. Okay, and then genus specific classification by LPS. Then coming to the serotype classification. So serotype classification, as I said, in trachoma we have A, B, C, B, A, B, B, A, C. Okay, in a trachomatis also we have A, B, C. Okay, trachoma, in inclusion conjunctivitis, trachoma is causing inclusion conjunctivitis, we have D, E, F, G, H, I, J, K. Inclusion conjunctivitis, genital chlamydia and infant pneumonia. So everything is caused by D, E, F, G, H, I, K. Then chlamydia trachomatis causing lymphogranuloma venereum, L1, L2, L3 is seen. And chlamydia pneumoniae, TWAR strain, respiratory forms is seen. So respiratory is the TWAR. Remember TAR. So TAR powerful, so attacks lungs. So TWAR strain. Sitaki means numerous strains. Then a few words about the lymphogranuloma venereum. Lymphogranuloma venereum, it's a primary painless ulcer. Secondary, it invades the lymphatics, goes to the lymph node, painful bubo, and tertiary stricture scarring, lymphatics obliterated. Okay. Lymphatics obliterated to lymph nodes, painful bubo. Smears may show Miyagawa granulo capsules. This just don't get feared, it's just an elementary body name. So painful buboes, we can have many elementary bodies, if possible just remember the name Miyagawa granulocorpuscles. Okay, then a tertiary means stricture scarring. So lymphatic is obliterated and strictures are formed. Then coming to the lab diagnosis, conjunctival material, urethral scapping, urine sample, blood, sputum, everything has been taken, and the buboes LGV. Then coming to the complications of genital candidiasis, Rita syndrome, conjunctivitis, urethritis and polyarthritis, Fitzhugh-Curtis syndrome. Any perihepatic adhesions or perihepatitis is called as, following any abdominal condition or maybe pelvic inflammatory disease in obstetric condition, it's a Fitzhugh-Curtis syndrome. And the most common micro examination is the gram negative, and poor other stains used are the Giemsa, Gene, Castaneda and Machiavello. Castaneda is important. Okay, and the Lugol's iodine, because of the glycogen matrix is present now, so it is can you remember chlamydia trachoma only glycogen matrix is present, in chlamydia pneumonia and chlamydia psittaci glycogen matrix is not present. So in chlamydia trachomatis Lugol's iodine is used, and it is not useful in chlamydia psittaci. And then isolation is by the McConkey cell line or maybe HeLa cell line, or maybe DA treated HeLa, pre-treated with McConkey HeLa, deoxyribonucleic cycloheximide, and then on DA it enhances replication. So chick, and another is the chick egg isolation, another one is the antigen by ELISA and antibody by uh, antibody testing. Okay, and then coming to the inclusion bodies in trachoma. So I already said that don't confuse with the HB bodies, that is the Anderson-Peterson bodies. Okay, here is that for molluscum contagiosum. Okay, Anderson-Peterson body, and SP strain or Floxian strain or Tartarate strain. But here it is the HP bodies is Halberstader, Provosaki, seen in conjunctival scrapings. Then words about chlamydia, pneumonia, it's Thwar strain already said. Respiration, Thwar is strong, so lungs. So exclusively seen in humans. Common aqueous form atypical pneumonia, and Taiwan acute respiratory strain, it is linked to atherosclerosis. So what are the other things linked to atherosclerosis is CCH, congestive heart failure, C congestive CCF. Okay, but here C the F into H, so chlamydia, CMV and herpes, chlamydia, CMV and herpes, and Sitaki. So Sitaki is the parrot, poultry occurs pigeon form as inhalation, incubation 10 days, pneumonia very very severe form. And then inclusion body in psittacosis, what is the inclusion body is LCL. So L for love means bird, so Levinthal Cole Lily, so Lily came, so Lily is a girl, so Levinthal is a boy. So Levinthal Cole Lily body in alveolar macrophages can be demonstrated. So, okay, so this is one of the brief and a long session discussing about Haemophilus, Bordetella, Brucella and chlamydia. And in next session I will brief about this MTB, these other organisms, and I will just brief it, and we will have 2 more sessions. Okay, this is part 1, and in last session we will just wind up with Rickettsia and Coxiella, and then we will try to combine everything in a small section, and we will just do it again, because it's very very important to do these kind of volatile things again and again and again, like however possible and whenever possible, because it will just go, because we are just trying to pick the not so important concepts behind it, and it's not being repeated again and again, so it will just wind up so easily. So all the best, we'll just continue later. Thank you.